What's wrong?
I'm having a migraine. I was right. Oh!
Is he gonna be okay?
No, something's seriously wrong with him.
The lengths that House will go to discredit this arch enemy von Lieberman. House now has quite a bit of ammunition for his master revenge plan yet to be revealed. Very excited to be reacting House MD Season 2 Episode 12 Distractions. On this channel we are reacting to all 177 House episodes. This would be episode 59. If I don't get the diagnosis before House, then I have to eat my least favorite fruit known to man, this massive grapefruit. I know you guys don't want to see me suffer, so let's hope I get the diagnosis. Let the show begin.
Adam, you're going too fast. Slow it down.
Talk about an explosive start. It's clear that something caused this patient to reflexively push the trigger and then keep it pushed. What could it be? A small involuntary movement wouldn't keep it there with such sustained power. Also, the patient was clearly conscious, which makes a generalized seizure very unlikely. A partial seizure where only a part of the brain is affected could, in theory, make just his thumb press the accelerator and make him lose control. But what magnifies the impact of that though is him being on a quad bike. Using an all-terrain vehicle like this is one of the most dangerous things you can do, especially for children. That reminds me of a case I was reading about earlier. I think it was in Canada. A paramedic was out in the wilderness with a quad bike checking animal traps. He was driving and his bike hit a rock which caused it to flip over and land on his leg, digging into his good calf. You see, his left leg had been injured from polio from when he was a child, and so he had no strength left to unflip the vehicle. He survived for 3 days on just animal carcasses and morning frost. At one point, being a paramedic previously, he thought he would have to chop off his own leg and eat it to survive. Thankfully, he was eventually found by a dog walker who had a funny feeling he needed to go in that direction, even though he'd never been that way. So yeah, even if they're not exploding under you, quad bikes should be handled with extreme caution. I hope Dad here has a fire extinguisher.
16-year-old status post ATV crash, 40% of burns on his body.
They're Maki.
Been looking for you.
Kid's heart rate's messed. His potassium's low, which means his potassium should be going up, not down.
You may be wondering what 40% burns on his body means, and it's the amount of coverage of the total skin surface area that is affected. More than 10% coverage gets you in the severe category. What's also extremely important is the depth of the burn. If it burns so deep that it goes down into the muscle, then it's severe if it covers just 1% of the body surface area. That's equivalent to the back of the hand or the genitals, although I'm sure you wouldn't need to hard-boil my scrotal muscles before self-classifying a burn there as severe. Now, the body tends to respond to severe burns like this patient has in a fairly predictable way. You get hypermetabolism, inflammation, muscle wasting, and insulin resistance as part of the stress response. All of this can cause a spike in the heart rate, which House has noticed with this patient, but it also usually raises the potassium, but Adams is low, meaning the condition that gave him a sticky finger also caused him to leak potassium. So what could that be? Hypokalemic periodic paralysis could be a good option. It usually presents in childhood or teenage years, and attacks can cause weakness or paralysis. It can be triggered by strenuous exercise, stress, or cold temperatures. To diagnose it, you'd either need family history or a positive genetic test, but that does take quite a lot of time, or you could find that the potassium is low during an attack, which obviously is quite difficult. In the old days, doctors were a bit impatient and also much braver than now, and rather than waiting forever would actually provoke an attack by giving glucose with insulin. Sometimes that worked a bit too well and provoked an attack while stopping the heart. Now we're a little bit more cautious and do exercise testing instead, which you may be surprised to hear is much safer. Let's see if the team go with safe or spicy or down another cuisine completely. But question for you smart people, what medication do we give to protect the heart when the potassium is high, and why? Answers down below.
Needs an EKG. No skin, no EKG. He'll live. We need help from a Belgian doc named Einthoven.
He's dead.
While he was alive, he invented a little ditty called the galvanometer.
Oh, those are some nasty burns. Seems to be 3rd degree, as you can see by the black charred tissue when they zoomed in. If you or someone else ever has the misfortune of getting a burn like this, don't do what you see here and wash it. All that does is disturb the tissue, which allows infection to penetrate into the wound. Cover it loosely with an ideal sterile bandage or a sheet that won't leave lint in the wound. No kitchen towel, please. Then go straight to the emergency department. So House mentioned Einthoven, who is a very interesting character, and not just for the galvanometer, which measures electric current. He used what he learned working on currents to create the first practical electrical heart trace. We still use the principles of that tech to this day to diagnose heart attacks and abnormal heart rhythms, and so he was a very deserving recipient of the 1924 Nobel Prize in Physiology or Medicine. Maybe House wants to source one of his old galvanometers because he can't use usual stickies on the chest because of the burn, so he needs to get a bit creative. Let's find out.
We're going to try a galvanometer. It picks up a pulse in the wrists and the ankles.
Looks like they're gonna electrocute him. Plug it in. You plug it in. That's not good. Turn it off! Turn it off!
I think House's malpractice pot needs a little top up on the current value of $500,000. That being said though, a galvanometer doesn't actually produce electricity, it merely detects it, so no teenagers were harmed in the making of this human experiment. So the patient is now having low potassium and seizure. I thought this patient could be having partial seizures at the start, but can you notice how what we saw was very different to what happened on the quad bike? His whole body was shaking, eyes were closed, it all looked quite violent. That's a classic generalized seizure that we call a grand mal seizure. I was once emergency bleeped to a 34-year-old patient with a low potassium of 2.9. It started out like this and then he had a cardiac arrest. We had to rapid infuse 40 millimoles of potassium, which is about half your daily requirement for a grown adult. Thankfully, we brought him back, but it's crazy that all that led up to that was some vomiting and diarrhea. Definitely a reminder to not just drink water when you're dehydrated and keep up your salts as well. Diorolite sachets are a good way of topping those up.
You've never been to one of these things in your life. Who is this guy?
I received my medical degree at Johns Hopkins University.
You went to Hopkins. This guy's von Lieberman? The guy got you thrown out for cheating?
The dean threw me out. Von Lieberman just ratted on me.
Oh, an old feud of houses has come back to light here. Very interesting. After seeing 58 episodes of House before this one, I know one thing. If you're on his bad side, then expect to either be stabbed with a sedative or some other kind of potion, intentionally infected with some kind of lethal bacteria, or have him take your wife on a nice trip to a tropical tiki bar and never come back. So House got kicked out for a different kind of cheating. I guess he's always been a proponent of the work smart, not hard philosophy, although I'm sure it's hard work convincing the dean to let you back into uni after you get caught. But maybe this Weber von Lieberman guy set House up to try and eliminate the competition because he knew he couldn't win head to head. I mean, I'm trying to go head to head with him with almost 20 years of extra trial data and I'm still struggling, so I can sure understand. Very interested to see how this plays out.
Are they trying to wake him up?
He's still under. The eyes respond to visual stimuli. You can track that with the sonogram. With MS, blood vessels are more reactive, so flows faster.
This episode is really pushing House's diagnostic creativity. We can't do an MRI, we can't do a CT because the patient wouldn't survive the transfer apparently. I mean, in reality, even with this patient's injuries, he could be covered and stabilized for transfer, but it does make things very interesting. You see, cranial ultrasound has been used in medicine, but mainly for children, as their skulls are softer and have smaller heads than we do. I've never seen that you can diagnose MS with an ultrasound, and there's no way this is actually possible. Also, his symptoms don't really fit with the loss of nerve insulation that comes with MS. That usually presents with something called optic neuritis, where you get reduced vision and pain in one eye, which is classically worse when looking around as it stretches the nerve at the back of the eye. In someone so young as he is, I wonder if he has something else that that could mimic MS, like metabolic could be B12 deficiency, infection could be Epstein-Barr, which is a kissing disease. If there's one thing 16-year-olds do, then that's kissing. Could also be something called ADEM, acute disseminated encephalomyelitis. Degenerative could be a condition called chronic idiopathic demyelinating polyneuropathy, or CIDP. Neoplastic could be a specific brain tumor of the cells that support the lining of the nerves called oligodendrocyte. The cancer could be the very easy to pronounce oligodendroglioma. Get that on a Scrabble board. Inflammatory could be non-MS autoimmune demyelination, which we basically don't know why it happens, so surely it can't be that. And way more interestingly could be toxins. Lead poisoning can definitely do it, but how could Adam get exposed to lead? He seems like an adventurous guy. Maybe he snuck into an old building with a secret flame and was exposed to contaminated dust. Could do a heavy metal screen to pick up on that. I'm going with lead poisoning as my first diagnostic guess.
I hear bowling is more fun than stalking, but I'm better at this.
We found some arachnoid bleed. There's no way to tell without...
Shut up!
You know, if my lecture is interrupting your meeting, I can wait.
Bahar Chakriya, as your people say in India. Appreciate it.
Oh, when House had his feet up at the start learning Hindi, he was looking at this guy's article. Now I think House is mocking him, saying that he couldn't get his work into a higher impact factor journal as all his colleagues locally discredited his work. So he had to throw the net out far and wide to bring a publication home. I've got a few publications myself and they're definitely not easy to get. You see, when we're in med school, we actually get points for our postgraduate jobs based on whether we are published in certain journals or not. An article is an article and you get the same points regardless of the credibility of that journal. So simple writing up of an uncommon case marks the same as discovering how to reduce aging. It's the application's way of saying you may win a Nobel Prize, but you'll never squeeze an extra point out of me. In all fairness, the chance a medical student produces anything of significance is so small that it is understandable, although some in history have gone against the odds, like Paul Langerhans in the 19th century, who discovered the cells in your pancreas that produce insulin while being a medical student. They're still named after him, the islets of Langerhans. Could probably retire after that. Now it seems the patient has a subarachnoid bleed, but that doesn't explain any of his symptoms. I think that would have been caused by the trauma, but they'll probably need to do some coiling or clipping through the groin, so he survives long enough for us to crack the puzzle. No idea how they'll do that without a CT though. Pretty much impossible. What a case.
Can you get it? I think so.
When I get there, I'm flying blind without a contrast CT here.
It's always been my understanding that unless you follow a daily regimen, no drug can prevent a migraine.
That's why they call it a breakthrough.
Is there anybody who doesn't stand to make a fortune from it, calling it a breakthrough? And how exactly do these studies work? You give this drug to a bunch of people and if they don't get a migraine, you go, voila, my drug works?
I love this scene. If House gets any more bitter, then he'll make this grapefruit taste sweet. What Chase is doing in that scene, by the way, coiling an aneurysm under ultrasound guidance. The only thing less possible than that is Joe Biden getting re-elected. Now I know House is trying to discredit his nemesis Weber's work here, but pharmaceutical companies have to go through fairly strict requirements before they get a drug license. They need to show that a drug is safe, why it works, and how it fares against the current best treatment for a particular condition. Only then do they get a license to sell it. In the past though, things haven't always gone so well, like thalidomide that got licensed for morning sickness and ended up causing severe birth defects with only 3% of those being affected surviving. Or a drug called DES that was supposed to prevent miscarriage and caused vaginal cancer. Or Bextra, produced by Pfizer, which is an anti-inflammatory medication that caused the severe skin reaction called Stevens-Johnson syndrome, which can kill 1 in 10 affected people. With all that in mind, I understand why some people are apprehensive about new medicines, but the threshold for approval now is definitely higher than it was even 2 decades ago. We should be more worried about the natural supplement market that has no regulations, no burden of proof, and are free to make whatever claims they like within reason. And the only reason why they haven't had more public crises because many of the ingredients are about as bioactive as Snorlax on ketamine. Now, if you'd prefer more Charizard level spice, then check out the channel membership. You get priority access to new videos, access to exclusive polls, and to suggest another series and episode for me to react to. The first 30 members have a chance to win a 1 hour one-on-one tutor session with me on a topic of your choice. We currently only have 5 spots left. So press join to secure yours before they are gone.
You sound very familiar.
Why did you publish in an obscure journal in India?
Neuroscience New Delhi is a respected journal.
The guy running Slurp and Gulp tells me it's one of the best.
House?
Here.
Adam had an orgasm.
House got busted. Although he looked less like he was trying to keep a low profile in the lecture theatre and more like he's about to join a high stakes poker match. He tried to discredit Weber's drug by showing it didn't work in an experiment House conducted on a coma patient. That got him laughed out the room, and so now he wants to increase his sample size by adding a whopping 1 patient himself. Him wanting to discredit Big Pharma with a 2-person study is like going to a gunfight and taking a spoon made of perishable paper. It wasn't just Weber doing some busting though, as Cameron spotted our patient having an orgasm during his sleep coma situation. She must have paid close attention in medical school during that lecture that we definitely all get. So what could this release of Adam's swim team mean? Well, to have an orgasm, some parts of the brain have to shut off, which is why it's so difficult to have one if you're focusing on having one. In males, those areas that need to shut off are the center of vigilance, and in females, it's the area controlling thought and emotion. The pleasure centers also light up with higher activation in males than in females. So what could be causing these centers to fire without compelling reason? It could be that this patient has damage to their amygdala, the main fear center in the brain, leading to something called Kluver-Bucy syndrome. It causes a very high sex drive and a desire to seek sexual stimulation from unusual objects. That condition actually has a very interesting history because of psychologist Henrik Kluver and neurosurgeon Paul Bucy. They had a particularly aggressive monkey named Aurora and decided that they would try and cure that by removing her temporal lobe. It did cure her aggression, but as they'd done the procedure on more and more monkeys, they noticed some had become hypersexual, both with themselves and others. Now, it was clear our patient hadn't had his temporal lobe removed while House was sabotaging his arch enemy, so what else could have done it? Herpes encephalitis would be a big one that could present in this way. The orgasms could even be a weird type of seizure as a result of that. That is a bit of an obvious one though, so autoimmune encephalitis could do it as well, but that means he has a cancer somewhere else that would be triggering the antibodies to be released. Typically that would be a testicular or an ovarian germ cell tumor, which would match the episode title of Distractions. That would be my second diagnostic guess. Testicular germ cell tumor with autoimmune encephalitis leading to ictal orgasm. Or if that's right, then goodbye evil grapefruit. Back to the hell from whence you came.
What's wrong?
I'm having a migraine. I was right.
Is he gonna be okay?
No, something's seriously wrong with him.
The lengths that House will go to discredit this arch enemy von Lieberman. House now has quite a bit of ammunition for his master revenge plan yet to be revealed. So how did House induce that migraine? He used a medicine called nitroglycerin, which can cause an immediate and delayed headache. The immediate one is because it relaxes the blood vessels in the body, causing them to increase in size. The delayed one is because the drug sensitizes the neurons that cause migraine and therefore trigger a headache in someone who suffers from them. There are so many things you can do to help reduce migraines if you suffer from them. tracking triggers with a headache diary, managing stress, increasing exercises, taking preventive meds like propranolol or topiramate if they're safe for you. Don't suffer in silence if you get them.
Could be an infection. What if it's just a regular old infection festering in the burned skin?
Dominic Larry, who's Napoleon's surgeon-in-chief, cleaned a lot of battle wounds.
By amputating legs.
And with bugs.
Maggots are implanted directly into Adam's burns.
Maggot therapy. Always choose your treatments like you choose your wife or husband. Go for effectiveness, not looks. House was right to mention Dominic Larry as he's the first ever modern military surgeon, but the first ever doctor to document the benefits of this maggot treatment was French surgeon Ambroise Paré. Initially he thought the maggots were destructive, but then came a change of heart. A patient who had a penetrating wound to the skull a few months after their surgery started leaking many maggots from the injury. The patient had lost bone on the head the size of a hand, but still survived. It does remind me of a 54-year-old patient I saw while I was on palliative care. He had a head and neck cancer that eroded the whole right side of his face. Every time he drank water, it would leak out the side of his face. And during his dressing changes, then we'd find maggots eating the side of his face. Poor guy was with us in the hospice because the family could no longer bear the sight or smell of the wound. Truly the worst way to go, and all from smoking. A picture on a pack doesn't quite tell the whole story.
Dear New England Journal of Medicine, I took this guy's drug and still got a headache, thus scientifically proving that my archenemy is an idiot.
The maggots did great for the burn, but the brainwaves are still all over the map.
Do a lumbar puncture. 2C3.
He wants to do a lumbar puncture in the cervical spine. Should have used Waze instead of Google Maps. It seems the reason why is the skin on his lower back is all charred and infected, so if they go on his neck, then it'll be less likely to get infected. One problem though, there's a reason why we do a lumbar puncture in the lumbar spine. It's the point at which the spinal cord ends, but we can still collect the fluid that surrounds it. In the neck, there is a lot of spinal cord. So let's play a game of would you rather. Possibly get an infection from a safe needle in your lower spine that will resolve with some antibiotics, or rupture the spinal cord in your neck and paralyze you from there downwards. Need to phone a friend on that one. We can use that procedure in medicine for very specific circumstances, and we call it a suboccipital puncture, mainly to inject drugs or when a lumbar puncture is definitely not possible, like a fusion spinal procedure. I still fancy testicular teratoma as a diagnosis here, and maybe something will stop them turning his cord into a cocktail sausage, please.
Needle. It's not going in.
Don't force it.
Going one space higher.
It's too close to his brainstem. It'll herniate.
I'm in the space. Give me the valve.
If Foreman gets any more focused, he may actually teleport to Neuroland, a place with rivers of spinal fluid and parks filled with MRI machines. Seems like he actually got the fluid though, so what tests would you want to run on it? Definitely want a glucose to compare with the blood glucose. That can give an idea of if it's a bacterial, viral, or tuberculosis infection. Definitely want to check for herpes simplex virus and other common CNS viruses. You'd also want to look at it under a microscope and try and grow anything in there, and check for antibodies like the ones in autoimmune encephalitis or MS. You'd look for oligoclonal bands, then take it from there. I have to say I felt the fear and focus Foreman appears to have here when I did an LP on a 25-day-old baby in hospital. The spinal spaces are so small that we have to curl up the baby really tightly, as tight as they possibly can, to make sure that they don't move. We're so glad to get it cleanly in the first time, and the baby was well after. It is a worrying time for us after doing a procedure like this, and always a relief to see your patients recovering. And I know what people think sometimes, you just don't want to get sued. Yes, that is true, but it also feels bad hurting someone. Like, have you ever accidentally hit someone? Imagine that, but times 100.
He doesn't have MS or an infection.
Come on, I need to talk to him.
House, you can't wake up a burn victim to play 20 questions. It's torture.
He won't remember.
It really hurts.
Any tingling in your arms or legs?
My pants, and then I don't remember.
Oh, who was House's trainer at med school? Saddam Hussein. In all fairness though, those look like full thickness burns, and the hallmark of them is that they're painless. The scene wouldn't quite have had the same ring to it though if the patient started eating popcorn during questioning. Also, peeing himself and then not remembering sounds a lot like a seizure to me, or a night out in Manchester. Still all matching my ball cancer theory.
House, you okay?
I'm hallucinating. I saw music. This is a brain with too much serotonin.
If Adam has serotonin storm, it's deadly.
But treatable. Cyproheptadine.
Serotonin syndrome, damn, if that's it, then they really didn't give us many clues. Usually it causes agitation, restlessness, fast heart rate, insomnia, but so would losing half your skin. In severe serotonin syndrome, it can cause seizures, but also tremor, high fevers, and unconsciousness. Also, spontaneous orgasm wouldn't be explained except through seizure, which could work in theory, but still isn't a great diagnosis. Either way, the drug cyproheptadine Chase mentioned blocks serotonin production, which helps drop the levels along with stopping the offending med. Also, House seems to want to be in pain after Stacy has gone. He feels that if he lets himself be happy, then he'll lose his diagnostic prowess. I know he's a character, but it's incredible how many people subconsciously stop themselves from taking action because of their own beliefs or thoughts. A simple example is in the international bestseller Baby Whisperer book, which I'm reading now. A mother to an 8-month-old boy was complaining that her child wasn't eating much, but when push came to shove, the mother didn't want to give up breastfeeding. So if the child's being filled up with milk, then of course they won't want that delicious, nutritious, mushy pear. So many times the real person holding us back is ourselves and we don't even know it. Strong message.
We don't judge. He's not depressed, we're sure.
Kid's happy.
We're back to where we started.
What's that on his wrist? A burn.
Your son smoke? No smoke meds or antidepressants.
He found out Adam smokes just from that circular burn in his wrist. I think I picked the wrong doctor to challenge. This is gonna leave a sour taste in my mouth. The kid got serotonin syndrome from having antidepressants, and you see the no smoke meds that he was taking work by inhibiting the reuptake of dopamine and norepinephrine. It has a small effect on serotonin, but the only reports of it causing serotonin syndrome on its own is in overdose. So which, if Adam is happy, he wouldn't do intentionally. So this still again wouldn't quite explain his symptoms, but I'm eating the grapefruit anyways because I said I would. So I have to, and I'm gonna enjoy it. I'm not sure if I can do this. It's me v you, grapefruit. Who runs out of juice first? The real question is though, why did the grapefruit go to the doctor? It wasn't peeling well. It's been years since I've actually eaten one of these. Look at that. Juicy. I thought it was an orange, and after cutting in, I'd already committed. I should like eating them more though, because there are actually quite a few health benefits of grapefruit. Here goes nothing. Oh man, what have I done? One bite down, 55 to go. I mean, it should get easier as we go along, right? Quarter. Yeah, definitely not getting easier. Speaking of the health benefits of grapefruit, you know what gives it this nice red color is something called lycopene, which is in the carotene family, and it's an extremely strong antioxidant, which is actually 10 times stronger than carotene. This is really good motivation to study harder. Oh, I think I'm gonna cry. It's so bitter. Bitterness overload. We're halfway. Oh man, I didn't even use all 3 of my diagnostic guesses, just 2. Why didn't I say serotonin syndrome caused by quitting smoking and taking dodgy no smoke meds? It was there in front of me on a plate, just like this grapefruit. So lycopene, antioxidants, why should you care? Well, because the body is in a constant battle to maintain balance between something called free radicals and antioxidants. You do need free radicals, and we use them in the immune system to kill invading pathogens, but when the level of free radicals gets too high, you get something called oxidative stress on the body. That can damage DNA and potentially lead to the development of things like cancers. And so antioxidants reduce oxidative stress by clearing free radicals. And this is a brilliant source of antioxidants. Some studies have actually shown that they can reduce the risk of some cancers, but you do need some more evidence to back that. And they can reduce the chance of developing diabetes, can be good for weight loss. But be careful having them if you take statins, because they can interact with an enzyme in your liver that clears statins, reducing your body's ability to clear that medication, which can lead to muscle aches or even breakdown. Oh, okay, halfway there, 25 bites left. I paid £1.80 for this grapefruit, which is already expensive, but I would pay 100 times to not have to eat it. Does any one of you actually like eating these? Apparently there's a trick where if you put salt on them, it makes them taste sweet because the salt blocks out the bitter taste. I've clearly researched. Just a quarter of the grapefruit left. This really doesn't get any easier. I'm almost there. Interestingly, the antioxidant lycopene that is in grapefruit also gives color to tomatoes. Although I would much rather eat a tomato than a grapefruit. Okay, I can't have this thing whole. Just too much. The thing is, it's so deceptive because when you first taste it, it's sweet and then it gets so bitter. When did we become a food challenge channel? This is the last piece of grapefruit. I've almost done it. Now, if you have ideas of what I should do next if I can't get the diagnosis, which hopefully never happens again, then drop it down below. It has to be something that is healthy but unpleasant. Let me know in the comments. There's a valuable lesson in all this. Get too distracted by testicles and you'll leave with a bad taste in your mouth.
Did you drop acid?
LSD acts on serotonin receptors in the brain, which can stop a migraine in its tracks.
Thank you for ruining my clinical trials. Sent them an email complaining about my math, telling them about your stunt.
We're even.
Right.
Universe always settles the score. I'm looking for a distraction. You don't need to talk to do that, do you?
Wow, all things back in balance. Von Lieberman got sabotaged with his pharmaceutical company pulling him after House sent a damaging email. The patient ended up better with some grafting and serotonin syndrome treatment. House found his distraction, and I've got 1 hour more of heartburn. Great episode, I'd say. 7.5 out of 10 entertainment, 4 out of 10 accuracy, and 7 out of 10 diagnosis. This episode makes way more sense when you watch the previous one where things get awkward between House and his ex. Here,